Okay, thank you everyone for joining us today. This webinar is titled Farm Workers and COVID-19 Policies and Resources, and it's presented by some folks from Farm Worker Justice, Rebecca Young, Isabel Gross, myself, Gabby Heibel, Myra Ryder, and then also Robin Louie to help us discuss some of the resources we've created. So just as a friendly reminder, please keep yourself on mute unless you're speaking. We'll have time for folks to ask questions at the end. Today's webinar is funded by the Training and Technical Assistance Project under HRSA, and the contents of the webinar are those of the presenters and do not necessarily represent the official view of HRSA, HHS, or the US government. Next slide, please. Thank you. Thanks very much, Isabel. So Farm Worker Justice is a national advocacy organization based in Washington, D.C., and we seek to empower farm workers and their communities in order to improve their living and working conditions, immigration status, health, occupational safety, and access to justice. And we do that in a variety of ways. Part of it is by providing some training and technical assistance through activities like this webinar today. Next slide, please. So today we're going to discuss farm workers and COVID-19. We're going to start by discussing farm worker vulnerability to COVID-19. Then we'll go into the effect that COVID-19 has had on farm worker communities. We'll quickly discuss some federal and state policies affecting farm worker communities, and then we'll leave the bulk of the time for folks to talk about the resources that we've created at Farm Worker Justice and ask questions. So as I'm sure a lot of us are pretty intimately aware, farm workers have been particularly vulnerable to COVID-19 exposure, and that's true for a variety of reasons. Part of it, just working conditions. A lot of farm workers are telling us that they show up to work and they're not provided personal protective equipment. They're not able to socially distance in the fields. This is particularly the case in the summer when, shaded areas tend to get pretty crowded as folks try and escape the heat. And then, they're very close together, so it makes it harder to socially distance. They've also been telling us that they have limited access to hand washing stations. And also when they go to their employers and say, hey, these conditions aren't safe, they're really worried about retaliation. The fear of retaliation is heightened when folks don't have documentation status, and they're a little bit more vulnerable to employer retaliation. Another bucket that sort of makes farm workers more vulnerable to COVID-19 are their living conditions. A lot of farm workers live in overcrowded housing, in multiple people sleeping in one bedroom, in bunk beds. It's just really hard for them to socially distance from one another. And then if somebody does get sick, oftentimes they don't have a place to isolate and stay away from their coworkers and other people who they're living with. This also becomes a problem in transportation. A lot of folks, share rides to get to and from work, and oftentimes there's not enough ventilation in those vehicles. And then finally, the final sort of other bucket, just things that are, sort of specific to farm workers. And things that are sort of more common broadly across industries. There's a lot of fear and stigma related to COVID-19. So folks are worried about telling others that they've been infected or that they've tested positive, or even getting tested to find out whether or not they're positive. They also maybe don't have the ability to take a day off of work if they don't have paid sick leave. There's also lack of health insurance and difficulty accessing healthcare. A lot of farm workers live in very rural areas. Maybe they don't speak English or Spanish, and then it makes it harder for them to communicate with doctors and health experts. And then there's limited information. So we're working with a lot of other groups to try and change that, but there has been sort of less information made available to farm workers. Next slide, please. And so it's not really surprising that we've seen that farm workers have been really affected by COVID-19. There's not a ton of data on the numbers of farm workers who have been affected, but Purdue estimates that more than 500,000 farm workers have been diagnosed with COVID-19 since the beginning of the pandemic. and that at least 9,000 workers have died. And then beyond those health consequences, there have also been a lot of economic consequences for farm workers. So a lot of farm workers have either been laid off or they've seen their hours cut during the pandemic. And part of that just has to do with, as bars and restaurants are closing down, farms, the demand for produce has decreased, and then employers are laying off workers or cutting their hours. Farm workers have also told us that they've had to miss work in order to care for children who, like a lot of us know, kids are doing online Zoom school, and that requires a little bit of extra attention from parents, which makes it harder for them to go to work. And also a lot of parents are having to skip work in order to take care of sick family members. And then also with kids not going into school, it means that another safety net has sort of been taken away from communities. So food assistance, access to healthcare, counseling, all those sorts of resources that were previously provided by schools are less accessible to communities. And so that's had a real effect on farm worker communities. 70% have reported that they've had more difficulty paying for food. 63 report having more difficulty paying rent, also childcare, difficulty paying for water. The consequences have been real and serious for farm workers. And then this has also led to consequences for folks' mental health. So there's been increased anxiety and stress. And as I don't think it surprises any of us, this has disproportionately affected women. And there are the population of women farm workers is quite large. So the consequences have been quite real. Next slide, please. So now we're going to touch a little bit on the policies that have been put into place in response to the COVID-19 pandemic. So on the federal level, there have been some efforts to make sure paid sick leave is made accessible to workers and farm workers included. The Family First Coronavirus Response Act from last year required that employers with between 50 and 500 employees provide paid sick leave. And it included both paid sick leave and some expansions to family and medical leave for reasons that were specific to COVID-19. That generally tended to be about 2 weeks of paid leave with a little bit of flexibility depending on the circumstances. But that expired on December 30th, 2020. The American Rescue Plan from 2021, relatively recently passed. It extended a refundable tax credit for employers who choose to pay paid sick leave to eligible workers. It was not obligatory, so employers can choose to participate or not. It included the same eligibility criteria as the Families First Coronavirus Response Act. So again, between 50 and 500 employees and a few other special requirements. And that is going to last until September 30th of 2021. Next slide, please. Thanks. Federal policy related to healthcare, there have also been some efforts to make sure that healthcare is made accessible to farm workers and the population at large. So again, the Family First Coronavirus Response Act established funding for COVID-19 testing for all uninsured individuals. So folks should be able to get tested free of charge regardless of their insurance. Also, President Biden has opened a special enrollment period for the ACA marketplace, and then he extended that to August 15th, 2021. And on top of that, the American Rescue Plan increased subsidies in an attempt to make sure that it's more accessible and affordable to folks. So individuals earning 150% of the poverty line or below will be fully subsidized. There are also protections to make it more affordable to folks beyond that point as well. And that will, those extra subsidies will last until September 30th, 2021. And finally, the American Rescue Plan, recently passed, has designated $150 million for community health centers in order to respond to COVID-19. Next slide, please. Thanks. And then workplace protections, as we talked about just a few minutes ago at the beginning of this presentation, part of the reason that farm workers are so vulnerable is going into work. They're at heightened risk of being exposed to the pandemic. CDC and DOL have set out some guidelines for how agricultural employers can protect farm workers, what steps they can take to make sure that their employees are safe. That includes recommendations for screening and monitoring when workers arrive to work, implementing workplace protocols to reduce COVID-19 transmission. So that includes PPE, social distancing, sanitizing, workplaces and also bathrooms and shared spaces. And it also includes some special considerations for shared housing and transportation. None of that is mandatory or enforceable. It's really just a guidance. It's a recommendation to employers. OSHA has not yet implemented an emergency temporary standard to protect workers. That might be changing, but it's not in effect yet. Next slide, please. So in the absence of enforceable workplace protections, some states have created their own enforceable standards. I'm not going to go too into detail since I think folks are coming from all over the country here, but Oregon, Washington, Michigan, and Wisconsin have all issued emergency regulations specific to agricultural workplaces, and those regulations have included housing and transportation requirements. California has issued an emergency regulation that covers all workers, so including agricultural workers. And those regulations include requirements related to employer-provided housing and transportation, which, as we discussed at the beginning, the housing and transportation is really key. And then other states have also issued other emergency regulations, and several states have enacted retaliation protections to make sure that workers who raise concerns about COVID or the safety within their workplace can do so without fear of retaliation from their employers. Next slide, please. And then vaccine access becoming more and more important as more and more folks try and get the vaccine. It's really important that farm workers understand that the COVID vaccine is free regardless of insurance. And while providers may ask for identifying information such as a social security number, patients do not need to provide that information. It's really important that folks understand that they can get the vaccine, that they're eligible for it regardless of their immigration status. And the CDC has made clear that they will not share any data about vaccine recipients with ICE, and ICE and CBP will not conduct enforcement operations at or near vaccine distribution sites. So folks can go get vaccinated without fear of any sort of immigration enforcement. And now we're going to pass it over to talk about some of the resources that we've created. So I'm passing it over to Becca.
Great, thanks, Gabby. So today we have a range of resources we'll be sharing with you. And at the end of the presentation, we'll be sharing a link so that you can access those resources. But we'll be able to talk about a vaccine fotonovela. We've developed a COVID bingo and loteria game, comic books, a children's activity book that's acts as a companion piece for that, a series of video PSAs, and a radio novella as well. Next slide, please. Great. So, for the fotonovela that we developed, that focuses on the vaccine. We developed that in conjunction with the National Center for Farmworker Health and health outreach partners as well. This was a fotonovela that was funded under HRSA. And it was a great experience. It came together really quickly with all of our organizations, and we all brought different types of expertise to that. But the real intent behind this is to answer common questions about the COVID-19 vaccine. We decided to create an outreach workers guide to companion with this. And the real intent behind that is to offer deepening information about a lot of the frequently asked questions and concerns around the COVID vaccine. It's available in Spanish and English, and currently we're working on a video version to accompany that. Next slide. And now we have with us today, Robin Louie. She was our partner for developing this Loteria or bingo game. And she is from the Rural Women's Health Project. So I'll turn it over to her now.
Good afternoon, everybody. And thank you to the team at Farmworker Justice for allowing us to share a little bit behind the idea of this approach to informing community members and giving them some power in terms of information. I think Gabby's introduction was really important to lay out certainly some of the challenges. I do want to help people to locate that we're in actually Florida, North Central Florida specifically. And in our state, we actually have another additional challenge, and that is that you must prove residency, not legal status, but residency within the state, which has obviously been a huge challenge for migrating farm workers as well as our community that lives here year round. So here at the Rural Women's Health Project, as a health justice organization, we've worked for about 20 years with Farm Worker Justice using visual and testimonial media approaches to inform community members about different topics. When we got together, we really started trying to identify what would be key in a tool that we could provide to the variety of communities that all of us are serving. And certainly we wanted to identify a popular education tool and one that would serve really the shifting Latinx and farm worker communities that at least we see here in North Florida. Certainly over the last 5 years, we have had an influx of Mexican and Guatemalan, as well as other Central American community members. And with that brings the diversity of language. So we were really clear that language barriers are huge. It's not just English to Spanish, but we're working with Mam, Mixteco, Canchoval, other speakers, and really making sure that we could be responsive. Of course, we wanted to make sure that Haitian Creole speakers, where there's a larger community in the southern part of our state, would also be included. But we also have noticed that, as we all have, with the influx of people crossing the southern border, we have a lot of parents with children. And so thinking about a tool that would be responsive to family dynamics and, of course, the power of children bringing information to their parents, or the benefits of when there are discussions at home. So we wanted really a tool that was lower literacy, that put less emphasis on language, because some of our Indigenous speakers are not literate. They speak the language, but they don't read it. And we wanted to make sure that all of our work addressed these greater access challenges that Gabby outlined. So here you'll see this game, La Loteria COVID, or COVID Bingo, right? This is a tool that we think helps to address many of these realities. It's visual, it's interactive, and it benefits both families and individuals. So if you'll take a moment to look at some of the images that are on the screen, one, you'll see the participation of an amazing group of community members. We were able to benefit from the participation of community members working with the Farmworker Association of Florida, as well as those other communities up here in North Central Florida. We wanted to make sure that the images were transparent in that they represented the shifting that we're seeing within farm worker communities ethnically and in terms of those with children or alone. And we wanted the tools to be something that would really make sure that everyone could see themselves somehow in these images. This is a bingo game where you're going to play it just like US Bingo. Instead of saying B6 and you identifying that on your card, there would be a photograph. If actually we could go to the next slide, thank you so much. You'll see that these are the cards. So instead of a ball with numbers that's rolling, you would simply select a card from a deck, and the cards would have a little bit of writing at the bottom. We have made sure that every single one of those cards, there are unique sets, so that Mom, the Mom language, is what's below. Haitian Creole, that's what you're going to see underneath it. And we're really looking at playing Loteria in the way in which it's played in Mexico, which is a series of images instead of numbers and letters like we play here in the US. But what's fun about the way bingo is played in this format is that the person who picks the card can give you a clue or say a rhyme that actually describes the image that you're looking for. So therefore, there's a lot more interaction. You're having to search for a match, or you could choose to simply just show everyone the card and look for the beautiful mother and son that we see in the upper right corner, right? This young son and mother, both with their masks, helping to represent the importance of masking as a way to reduce risk. So again, you can see that the bingo game has an element that's culturally enjoyable. It's visual. It helps our lower literacy readers. And I think for us, what's really important is that it supports three important tenets of our work at the Rural Women's Health Project. And I really believe that intersect with farm worker justice. and that is that we, one, present realistic options. So part of that, I can tell you early in our work last year around COVID was we couldn't talk to people about masks if we weren't able to provide them. And we know that early into the pandemic, finding a mask was a challenge. So we wanted to make sure that it was realistic. We, in our area here, will make sure that this game goes out with a packet of masks, and we actually have children's masks. The second is that we want to model these good behaviors or healthy options. So you see Don Emil, the man in the blue shirt at the top. He is a gentleman that we work with through the Farmworker Association. And there he has those 2 masks, really modeling the latest of the CDC policies. And then, of course, it's really the concept of each one, teach one. So this game and the interaction, whether it's adults playing it or children with their parents or with others, is that we're going to be showing each other what we know. So I'll look at the picture and go, wow, that looks like my dad. And he always wears a mask when he goes to work, so that we can really create conversation and discussion, which is really critical to that education gap that has resulted in this last year. As we've been discussing, we focused on multiple languages. And why? Because if you're in the state of Florida, the state Department of Health has really refused to put out messaging throughout the entire pandemic that was in languages other than English. To find something in Creole or to find it in Spanish, you need to know English, dig through the website, and to be able to find it. These are tools that you all can get out through your health department, through the legal outreach that you may be doing at certain sites. It's great for early Head Starts, who will also be recipients of these tools, and any of us that have opportunities to interact with farm worker communities. In our case, I'll let you know that on Saturday, we're blowing this up to a large size, and we'll actually have members of the community playing this game at our celebration of Dia de los Inmigrantes, so the Immigrant Celebration Day. Again, finding different ways in which we can allow a simple tool, a visual tool, to be an interactive opportunity to address the challenges that farm workers have experienced in accessing information, testing, as well as obviously now the vaccine. So that's just a little bit of, I think, the thoughts behind how we came up with LOTERIA, or the COVID bingo. And we hope that you will know that this is something that you can access and download. There will be instructions about how to print it, what size paper, where to cut it, how to share it within the community, popping it in that gallon-sized plastic bag. All that information will be available within the instructions, so that this is a tool that you can just go to, grab, and share. So thank you for the opportunity. Let's look to some of the other tools that Farmworker Justice has prepared. Thank you.
Thank you so much, Robin. And the other thing I just want to highlight about that bingo game, I mean, people have been through so much this year, and as Gabby said, it's had real consequences on people's mental health. So I sometimes joke that at Farmworker Justice, we're team fun, because we're always developing, you know, a fotonovela, where it's a game, it's a comic, but, you know, that really also speaks to accessibility, but also just, what would you rather do right now if you've had a tough year? Would you rather absorb the information through a game, or would you rather read a big text about it, right? So I think that's a really important strategy as well that I'd like to highlight. So those last 2 resources that you saw were funded by HRSA. These next ones are, we're a subgrantee on a CDC project. And we've developed a variety of resources. Here you'll see the first of 2 comics. This one is about tips to limit spread of COVID in the home and in the workplace. And what I'm really proud of with this resource is it's very specific to farm workers. It's very specific to their living conditions and their working conditions. So you can see here at the beginning, they're all on the bus on the way to work, which is a very common circumstance, right? You may be able to distance in the field, but not necessarily on the bus. So here we're talking about opening windows and wearing your mask on the bus as a way of, if not totally preventing the spread, at least mitigating it some. Similarly, here you can see in the workplace, we have lunch tables showing people how to distance during their lunch breaks. And then in the final panel, you see there's a recognition that farm worker housing is often crowded, and you may have to take kind of creative or difficult measures to prevent spread in the household. So these are very particular to farm workers' circumstances. And they're also acknowledging that there's a range of people in the farm worker family. We're not always talking about mom, dad, and kids. We're often talking about elders as well, who, as we know, have been extremely affected by the pandemic. And so, as you see in the next panel here, we have not only mom and dad, but we also have grandma taking care of the daughter. So we really wanted to see those figures represented there. And I just love also the scenery of the comics. Again, the very visual nature of these. They're available currently on our website in Spanish and English. So that comic, as I said, was about distancing and prevention in the farm worker home and workplace. This next comic is about testing, which we know testing has been difficult to access or misunderstood in certain areas. And here we see 3 farm workers talking about when to get tested and why to get tested after somebody in their workplace has been exposed to COVID. So we're talking about, why would you want a test? You don't look sick, you don't have symptoms. And later on in the comic, they go on to explain that it's about protecting your family and community, kind of appealing to that tight-knit nature of the farm worker community. Again, here we have a focus on the family. So a different family configuration here, honoring that diversity. So the farm worker, Jorge, lives at home with his mom and his grandmother, and those are the people he is concerned about protecting. And a wonderful artist from Mexico drew all of these pictures for us. He does a really good job of really showing who is a member of the farm worker community, showing those different family configurations, and also locating them in the geographical context you can see here of the fields. So those are both available currently on our website in both Spanish and English. Now I believe Becca is going to talk to us about the activity book, which is our companion piece for children.
Great, thanks, Isabel. So as we were conceptualizing these comic books, we were really thinking about how can we help the whole family benefit from these educational resources. And we knew that it would be really important to find these pieces that could work well for younger and sort of middle school children too, so that they could be a part of that learning process and it could really happen together as a whole family. So we, again, in conjunction with the artist Salvador Sayens that Isabel mentioned, we worked together to develop this activity book. It's really fun. We kept it in black and white so that the children can color the images that they see too. And there's a whole series of different activities that are all COVID, of course, related. There are word searches, connect the dots, find the hidden objects, find the differences between pictures. There are mazes. And then the topics kind of cover a range with different preventive measures like mask wearing and social distancing, hand washing, and then approaching the vaccination as well. And then this is also being offered in Spanish and English. Great, next slide.
And I believe we're back to me now. So in addition to the written resources, we know that not everybody had the opportunity to go to school. Farm workers have an average of an 8th grade education according to the National Agricultural Workers Survey. So we wanted to make sure that people who never had the opportunity to learn to read and write could still see themselves represented and could still access this information. So in addition to our written resources, which we would hope are also fairly accessible, we developed some audio and visual resources. So here we have a still from some video PSAs. It'll come in 2 forms. One will be a longer video that people could watch all at once and have a little bit of transition information. The other will be 5 short videos, which are included in that longer video and which are better for sharing on social media, maybe via a WhatsApp group. And so the aim of that, right, is that we maximize the reach. We can get as many people through as many platforms as possible. Again, we have a variety of topics. We're looking at testing and asymptomatic spread again, different kinds of prevention, vaccination, of course, prevention among extended family, because we know that farm worker families are often large and quite tight-knit. really rely on each other for support. And then the most exciting part of this project, at least for me, was that we have actual farm worker activists as the actors in the videos. They are affiliated with one of our partner organizations in California, Líderes Campesinas. They speak English, they speak Spanish, they speak Mixteco. And so we decided to do Spanish and Mixteco videos. And all of the people you see are real farm workers who have to make these kinds of choices every single day. It was a really exciting opportunity both to just to really showcase them and their talent, and also engage in a little bit of capacity building with acting, which I think they enjoyed. They're really talented people. So here are some more stills this is the prevention at home video. And here I believe they are talking about prevention in the workplace. So those again are 5 short segments. They're not available yet, but they will be soon. And finally, we have a radio novela. Again, all of the voice actors are farm workers. It should be about 4 minutes long. It'll be produced in Spanish and Mixteco, and it focuses on a couple of farm worker friends who are discussing topics about prevention, about vaccination, prevention among the extended family. But the radio novela really digs into the choices farm workers have to make, right? And trying to give them that sense of agency, that there are things that they can do that make the hard choices or the hard circumstances of the pandemic a bit more bearable. They might not solve the problem, but they make it a little bit easier. In, again, Spanish and Mixteco both, which are with our really, really talented farm worker cast. So I believe those are all of the resources we have to share with you right now. So we can move on to our question and answer section.
So just to remind everyone, you can drop all your questions in the chat and we'll make sure our panelists get to them. Thank you. So Jocelyn Castillo has a question. I'm going to allow you to unmute yourself. Jocelyn? Well, I'm not sure if we still have her with us, but we have a question from Ismael Camacho about whether we can make the information available via email. Yes, so these materials will be available to everyone, and we will send a follow-up email telling you how you can access the materials and the recording.
And we also have, at the end of this presentation, we've included our email addresses, as well as citations to a lot of what we, a lot of the information that we discuss in this presentation. But feel free to reach out to Becca, Isabel, or myself if you have questions after this presentation.
And if anybody would like to ask a question and unmute themselves, please use the raise hand button and I can enable you to unmute.
I also saw a question about where the videos and radio pieces would be available. You can look for those again on our website. We'll have the link in a second, and hopefully also our social media and our community partners' social media.
And we also have a question about whether the videos and PSAs can be used and reproduced by other organizations in other Mesoamerican indigenous languages, and who is the artist from Mexico we work with. Isabel?
Sure, I can take that. I mean, I would personally love to produce it in every single Indigenous language known to man. I'm not sure if that's possible under this project framework, but we're always adding to our resources in Indigenous languages. Even with the bingo project, we started out with just Mixteco and then we added Mom. So we're really trying with Indigenous languages. You know, I was in Guatemala in a community that spoke Ixil. Dialectical differences can be pretty hard. And so we really try to make them as intelligible as possible. And sometimes that means focusing on fewer languages and doing them really, really well, as opposed to trying to find the one that's maybe going to reach the most people, but we're not really sure. So, I mean, yes, absolutely. In the future, we are going to try to do things in as many languages as possible. That's really important to us.
And we have a suggestion that the material that has been created can be improved with more hygiene measures.
Yeah, and I was just going to mention, so those were, you know, just sort of some snippets or highlights, I would say, of the material. You know, so, but we're always open to feedback. And I think once you look at the full resources, if you have feedback to offer, we're always open to hearing that.
And I believe in our first comic, we discussed hand washing, but also disinfecting surfaces. And in other parts of the materials, I know we also talk about, you know, if you can't wash your hands, for example, if you're a farm worker in the fields, the hand washing station is far away, don't touch your face. So we tried to incorporate a variety, but as Becca said, you're only sort of seeing the highlights. You'll have to go to our website to get the full version.
So the next question is, which resources are going to be translated in Haitian Creole?
The Loteria game is available in Creole currently. So that is one piece that you can pull from.
We also, unrelated to COVID, have a variety of Medicaid resources that we're putting out in Haitian Creole, but a lot of the materials were developed under a project specifically focused on the Latino population. And so that's why the focus on Spanish and some of the indigenous languages spoken in Latin America.
And I was just going to mention too, also non-COVID related, but we do have other resources on our website about nutrition, healthy eating, exercise, etc., that are also in Haitian Creole. You know, if you're interested in looking at those, but not COVID related.
We also have a comment from Ana Elisa. In the vans where workers are transported, antibacterial and sanitary wipes can be used so that they can clean their hands. Antibacterial spray can be added on the shoes.
I saw there was a question in the chat about if our community partners have resumed outreach yet, or how we're planning to get the Loteria to workers out there. So a lot of our community partners have been doing different types of outreach, I would say really all along, you know, kind of after the different kinds of lockdown lifted, et cetera, probably as early as last summer. They've definitely changed their strategies for outreach. So of course they're not doing necessarily like those large group gatherings anymore. They don't always do as many house to house, family to family style, but sometimes they do a lot more activities outside. But the great thing with these resources, and I think with our community partners in general, they're so active right along all the time in their communities, and these materials they can bring along with them as they're, you know, if they're doing blood pressure checks or, you know, other kinds of regular outreach or COVID outreach, that they can bring these materials right along with them. So yeah, I think a lot are already very active in their communities again. Maybe not reaching as many like high numbers at a time, but certainly reaching out there.
If I can also put in, we've been working a lot with a comunicadora approach. So we have our promotores de salud, but the comunicadoras are actually doing all of this through WhatsApp and through phone calls. And so they have their network of community members, and these materials we're still using. So for our upcoming training with our promotores and comunicadoras, we'll actually teach a way in which to try and use LOTERIA through WhatsApp, just with some interactive aspects of it. Again, being cautious. I will also say that more of us, as we get vaccinated, feel obviously more comfortable doing the outreach within at the farms and other community settings when we're outdoors. So I think that there's an opportunity to do more face-to-face, which makes a difference.
We also have a question about how can farm workers get an interpreter if their primary language is Mixteco or Triqui?
I would refer, and maybe Robin has an answer to this, there are a couple of wonderful organizations in California. I'm not sure where the questioner is from, called CBDIO, Centro Binacional del something Indígena Oaxaqueño, something like that. They have a lot of wonderful resources for that. There's also MICOP, which is a Mixteco media outlet, nonprofit. So there's some really wonderful organizations doing work on that, and I think they might have a better answer. What do other people think on that?
I've also just put into the question and answer response 2 options: Language Access Florida, which is here out of North Central Florida, as well as Maya Interpreters, another Florida-based opportunity, and both of them have Mixteco. It depends on which version, but there is Mixteco. Yeah.
We have a comment from Michael. It might be interesting to mention that COVID protocol of the Equitable Food Initiative available at equitablefood.org. And a question from Coraima. Do these resources also include information on the vaccine? For example, how it works, common myths in the farm working community about the vaccine, etc.
Our vaccine fotonovela does. Yep, that's specifically focused on the vaccine. And in the Promotora guide, you'll find a lot more extensive information than just what's in the fotonovela. The idea being a promotora or promotor would have a conversation with someone and would need the answers to those common questions.
I saw a question in the chat, just are there resources on the website? So again, we will be offering the link in just a moment here that will link you to our website. Some of the resources are already available and others are yet to come and should be there soon. So just, you can just keep checking back to our website.
And you can see the links to additional organizations and resources in the chat in answer to some of the questions that were posed earlier. I'll just allow one more moment in case anybody has any additional questions. As Gabby mentioned, the presenters' emails are available, and we are going to send a follow-up email. So if you have any additional questions after the end of the webinar, you can always get in contact with us. If there are no additional questions, I will ask you to please stay with us for another minute. We have an evaluation survey for us to give us your feedback on the webinar today. It will only take a minute to complete. So if you would like to, please click on the link. I have just put it in the chat. It's just a few questions that will help us design future activities. If you're not able to click on the link, the survey will pop up on your screen after the end of the webinar. But we have one additional question from Annalisa. How do you handle the information of agricultural workers who do not want to get the vaccine when religious beliefs do not prevent them from getting the vaccine?
Yeah, it's such a hard one. So I think that's really just, referring to the vaccine hesitancy issue, which is, it really is so prominent, I think, in the communities where, that we work in. And it is tough. I would love to also just, if there are others, on the webinar right now that have experience, as they're out in the field or doing outreach, and really working to combat that vaccine hesitancy. I think it would be great to do, if anyone has strategies to offer in how they talk about that. We know just from our community partners, having those promotores out there who are such incredible role models in the communities really help to put people at ease, to bring up their concerns, and especially if there are those promotores that mentioned that they were hesitant, but went through with that, maybe felt a bit sick for a day, but that they were fine ultimately. Really leaning heavily on the importance of thinking about how can we all help to take care of our families and our community at large. So really trying to focus on the really positive aspects of that, and listening to people's concerns. But we'd be really interested to hear if others out there have had success and how you all have been talking to those that are hesitant in your communities.
We have a comment from Mary Jo, who says, we created a myths and facts sheet addressing fear and hesitancy. Thank you. And we had a question from Adriana. Are the resources you offer on your website printable? And yes, they are printable.
We'd love to see that. I'm sorry, we'd love to see that myths and facts sheet that was created by Mary Jo. If you'd like to pop an address where people could find that into the chat, that would be great.
And you'll see in the chat box the emails of our presenters as well. So we'll allow one more moment in case there are final questions or comments. I have put in the chat again the evaluation survey link. Please be sure to take a minute to fill that out. And I would like to thank every one of our presenters today for all the great information. And thank you all for participating in this webinar. Any questions you can send to us following the webinar as well.